Not discouraged by the timing question. We are dealing with unbelievably complicated issues. And the problem is, I think the real problem is, they aren't the issues. Healthcare comes closest. Healthcare and climate change, which people don't associate to their daily lives. They associate, where's my job? I got paid more last year. What's my future? And that is what we are not talking about enough, because we're stuck, in a sense, on health care, which is complicated, where there's real contention between Democrats and Republicans and all of that.
But the people, Senator, have spoken. I mean, the polls are very clear that the American people want reform, and I can't help but think that last night's results were because we haven't had any results when it comes to the big issues. Number one, creating jobs. We'll get to that later. But the health care. I mean, it would seem to me that if the senators on the Democratic side were to step up and say, I'm going to support the public option, even though it's a small part of the bill, it does open it up to other things later on, their poll numbers would go up. They wouldn't be.
They do. The Democrat, they do support it. Harry Reid's laid it down. It's in the mark. It's part of the deal. They do.
But what about Ben Nelson? What about Blanche Lincoln? What about Max Baucus? I mean, we got to get 60 votes on this.
That is part of what the president should be doing.
Okay, so you agree with me that maybe not going to Madison and going to Capitol Hill and engaging is probably a pretty good strategy.
Indeed, I do, although I think education is kind of an important subject. But right now, the day afterwards, no. Here and using stronger arm tactics.
What is the White House doing wrong? What should they do right now? I mean, if our base is not telling them what we want, how are they going to know? I mean, it would seem to me that the president this morning should have had a breakfast with leadership and said, all right, look, the people have spoken. We got to get this health care thing done. You're talking next year. Let's get it. What do we have to do? Who do we have to tip over on this? It would seem to me that would have been the call today.
I agree with you, but it's not the way it worked out.
Yeah.
So he's in Wisconsin. He probably gave a good speech. My people back in West Virginia, they care about jobs. They're terrified of climate change, maybe unnecessarily so. But here I am talking to you, which I'm delighted to do. I'm not back in West Virginia, and I probably ought to be back in West Virginia talking to them about their day-to-day problems, most of which has to do with having enough money to eat, taking care of a sick child, or holding on to a job, or getting a job they once had.
Senator, great to have you with us tonight.
Thanks, Ed.
Thank you so much. Senator Jay Rockefeller with us from West Virginia. A late development tonight over on the House bill. The House will vote at 6 o'clock on Saturday on health care reform. George Miller going to join me in a moment talking about that. Single payer, by the way, on the ropes. An amendment has been offered to allow states to choose to go to a single payer opt-out system, okay? Now, leadership has decided that they're not going to allow any hearings on it. Instead, they will put it up to a straight up or down vote. In essence, that's a death sentence. I think it's about respect. Single payer is a progressive issue. Universal health care is a benchmark issue and a platform issue for the Democratic Party, and I think it's a huge mistake and a slap in the face not to allow the single payer voices to be heard in all of that. It is not a good setup. For more on all of this, let's go to Roy Sekoff, founding editor of the Huffington Post. What happened last night, and what does it mean, Roy? What do you think?
Well, Ed, you know, it was definitely a wake-up call for the Democrats and for Obama, but it wasn't a clanging alarm clock like they're trying to tell us. It was like when your wife wakes you up firmly but gently, shakes you, and whispers in your ear and says, it's still the economy, stupid. That's what the numbers were telling us, Ed. 89% of the voters in New Jersey said that they were worried about the economy. 85% of the voters in Virginia said that they were worried about the economy.
Is that what moved the independents, Roy? Is that because if you look at this graphic, you got in New Jersey, the GOP, of the independent votes, 60% of them went to the Republicans. In Virginia, 66% of these independents ended up with the GOP. Is it the economy? Is it results-based?
Well, it's a combination of the two, Ed. There's absolutely no question that there was no excitement and passion from the progressive and the Democratic base. That's why you saw those numbers. And any time that you have this kind of economic numbers, the incumbents are in trouble. And that's why Obama, I agree with what Doris Goodwin said about him having to tap into his inner LBJ, but he actually needs to tap into his inner candidate Obama. Looking back at what Obama was saying, you were having this one-year anniversary, the great documentary last night on HBO, and and you saw what he said. He said that he had gotten into the race to fight special interests, and because of, these are his words, the people were getting hosed.
Well, he's had a lot of special interest folks over at the White House, and
well, that's what I'm saying.
It's been a cozy relationship for the first 10 months with the special interests, it seems to me, and this president just fails, in my opinion, to hit the floorboard and go running. He just can't throw the Republicans overboard on this.
Ed, it's about atmospherics, and you're right about the message. The message has been the Wall Street kingpins have been treated like kings. The average person, not so much. You know, prime seat at the table for the insurance companies, for the drug companies. Yeah. The average guy, not so much. And I think people are saying, wait a minute, this kind of feels like business as usual. This doesn't feel like change.
Roy, good to have you with us. Always a pleasure. Thanks so much.
All right,
you tell
Ed.
it like it is.